We begin with breaking news out of Spain's Canary Islands on the evacuation effort now underway for dozens of passengers on a cruise ship that was hit by a deadly hantavirus outbreak during an Atlantic voyage. This is new video into our newsroom of the first plane to take off, carrying Spanish citizens to a hospital facility in Madrid. And what you're looking at here, other pictures new this morning of another dramatic operation linked to the outbreak that is happening today. A specialist team of Army and medical personnel have been parachuted onto the British overseas territory Tristan da Cunha, a remote Atlantic island, after a British national showed symptoms of hantavirus. That person is currently receiving treatment as a case of suspected hantavirus. We have in-depth coverage of this story as it continues to develop. Let's begin with the CBC's Briar Stewart, who was on the ground at the port in Tenerife. Briar, with the evacuation of passengers from the ship already underway, we know that officials have been giving an update as to how it's going so far. What are they saying today?
Well, I just spoke with an official from the World Health Organization who said it's going very well, going as they hoped and as they, I think, probably expected it would in a way. What we know is that of the more than 80 passengers still on the vessel who arrived here early this morning, they were all asymptomatic. But at first, health experts went on and they did a very quick assessment. And at that point, they were letting people depart. They were taking them off the boat in groups. And the order really determined on whose plane was ready at the airport to depart, because basically once the plane was ready, they would then escort people off the boat. And so Canadians have left the boat, we understand. It's not entirely clear whether they have also left the country, but how the process works is that they are escorted on these small boats wearing kind of full protective gear, hands, gloves, masks, and protective an overcoat. And then they're spend about 10 minutes on the ground here in the parking lot, and there's another quick assessment that's done. And then part of actually what it takes place here is they hand their documents over to a police officer, because when they're taken to the airport, they're basically driven right up to the entrance to the plane. So this is sort of functioning like a land border, if you will. Now, this is obviously something that I'm sure a lot of them have been looking forward to, getting off the vessel ever since this outbreak of hantavirus occurred. And obviously, I mean, they're able to access the internet on board. They're getting the updates. They know what a serious situation this is. But the next step in all of this is, of course, isolation. And I did speak to the World Health Organization about how they would prefer passengers to isolate. Here's some of my interview.
Each of the countries is completely, it can be autonomous. They can make some modifications. For example, they can add, as the government from Spain, adding some testing, adding some strict follow-ups. But what we recommend is the quarantine for up to 42 days, given the long incubation period that this virus has.
Now, in terms of that quarantine period, you mentioned that 42 days. That's 42 days from the last known exposure. So that's not starting today. It's starting the last time they came in contact with a positive case of hantavirus. And I think what we kind of have to watch for is different countries are approaching isolation differently. For instance, in the UK, Brits are being flown back and they're going to be directed to a hospital where they will stay. In the United States, we understand that passengers from the ship will be taken to essentially a quarantine facility in Nebraska. We're still waiting to hear from the Canadian government what the plans are for these passengers, but obviously we can expect there will be some kind of isolation period, particularly because this is a virus that can have a very long incubation period. It can be weeks. That's what the World Health Organization said. So when I did speak with them today, they said, they think that this process is going well. It's carefully choreographed, but they do say it's not unexpected if there were more cases.
So we know more than 20 nationalities were on board that ship, again, all being taken in different time frames back to the plane that will eventually bring them back home. What do we know about the people who are on the ship, the crew there, and what will happen to the ship from here?
Yeah, there's quite a few members of the crew still on the ship, about 60, and they're going to stay on the ship. Quite a few of them are actually from the Philippines. And the ship will be here for another day and a half because there will be some passengers departing tomorrow from Australia and New Zealand. But after that, the ship will be here for a little while longer because it essentially needs to restock and refuel, and then it will be making its way to Rotterdam, to the Netherlands. And so that's another 5-day journey. And it's not just the crew that's on board the ship, so is the body of a German national who died back on May 2nd. So obviously, you know, will be other protocols to follow once that ship arrives there. And like here, the crew members will certainly be subject to some period of isolation.
We know that prior to the arrival of this ship there in Tenerife, there was a lot of pushback. People were very upset about the possibility of this ship going there. What is the sense there right now?
Well, I can say that over the last couple of days, there was some talk in social media about trying to block this from happening, and we didn't see that transpire. And that may be because people saw how this was going to be organized, and the fact that the passengers are spending very, very little time on the ground here, essentially over at the other end of the parking lot for about 10 minutes before they're put on the bus. But the World Health Organization is very aware of that very real fear, because people are remembering what it was like during COVID at first, when maybe, you know, it was starting to circulate. People weren't too worried, and then we all lived through this, period of lockdown, and just the number of deaths and the fear around that. So the World Health Organization is very aware of that. In fact, you had the Secretary General of the WHO write a letter addressing the people of Tenerife, saying he understands that the fear is real, but this is not COVID. This is something that they've been repeating in recent days, and that's something that they will keep repeating, I'm sure, as the contact tracing and the isolation period continues.
All right, thanks so much for this, Briar Stewart in Tenerife in Spain's Canary Islands.